welcome to another episode of Simply Healed. Today, we're going to talk about cancer, and we have our in-house expert on lifestyle medicine in support of cancer, especially Dr. Jansen. Dr. Jansen, it's so lovely to have you here again today.
Hi, Sean. Hello, everyone. Glad to be here again, and thank you for coming.
And today's topic is cancer stages. What stage are you? You know, this is a special request from all our viewers, yourselves, from you guys, all right, and gals. Okay, and I was discussing with Doc Jansen, you know, one of the most common things about, I guess, developing cancer or getting cancer is this: we don't want to go for a scan. I think it's a natural reaction to pretend nothing is wrong.
Yeah.
So I asked Doc Jansen, is there some simple things that you can take note of that you don't need to go to the doctor to, but once you see these things, you should really go to the doctor, all right? Because I know some people say, oh, it's something else. I'm just having a cough. It's not lung cancer. I'm just having a cough, all right? So, or if your breast hurts, you said, oh, I went to the gym too much. In fact, it's because I'm healthy, because I exercise a lot, all right? So I think Doc Jansen has prepared very easy to recognize telltale signs that you should be worried and that you shouldn't pretend it's nothing dangerous, and you quickly go for a proper diagnostic. All right, so Doc, once again, welcome. Is it really true? Do you meet many people who don't want to know what stage they are in?
A lot of people, but I think it's valid though. I mean, if you
don't want to scare yourself all the time also, right?
Yeah, and there's that fear. Of course, if you feel something, I mean, you know in your heart there's something wrong, but you are afraid to confirm what you already know.
Yes.
Yeah, so there's always that fear, which I think it's very understandable for a lot of reasons. But of course, you have to realize that you have to get treated as soon as you can, because if it's cancer, time is against you. Okay, the longer that you delay your treatment, then the longer, the worse it will get for you. Okay, because the prognosis for cancer is always dependent on what stage you are first diagnosed, on what stage you first get treatment. Okay, the longer you delay, the higher your stage is, then the worse it is for you, for your prognosis. Right? So now, how do you know that once, hey, I'm feeling something here? How do you know that, okay, I am thinking of this might be cancer, or what the feeling that you are having right now is, yeah, this is not cancer, this is something else. So how do you know that? So first, let's zero in on a few
types of cancer.
A few types of cancer. So I will be discussing 4 types, the 4 common ones. So lung cancer, breast cancer, prostate, and colon cancer.
Oh, that covers all. And before Doc, you even share, Doc, if you discover breast cancer in early stage, like stage 1, stage 2, what is the chances of successfully fighting the cancer?
Almost 100.
Almost 100%, guys. Almost 100%. So this tip that Doc Jansen is going to give you, if you feel it, I mean, if you have these signs, don't hesitate. Go for a mammogram. Or
go for an ultrasound, a mammogram, or just have a doctor,
look at it.
Look at your breast, do a physical exam on the breast, because with just the physical exam, a doctor can tell if it's benign or malignant. Okay?
Wow, and the success rate is almost 100%.
Yeah, if you get treated, as early as possible.
What if that cancer? What if you delay? You say, I pretend it's nothing, and by the time you do realize it's really breast cancer and it's stage 4, what's the success rate for stage 4?
Okay, for stage 4, that would go down to around 50%.
50%. You have a 50% chance of living and dying. Wow, that is like flipping a coin.
As low as it would again depend on what age, but 50% is the highest. So it can go as low as 30. So
it could be 30
to 50.
Or so from 30 to 50. So it's pretty serious, guys. So these tips that Doc Jansen are going to share should really help you. Again, if you discover it early, it's 100%, almost 100% success rate. If you ignore it, it becomes 30 to 50% success rate. That's a huge drop. So without any more delay, I think the people want to know. I think many ladies right now have their hands on their chest ready to try out the little tips that you're gonna
So
give?
since we're already discussing breast cancer, no, so we will start with breast cancer. So all ladies have lumps in their breasts.
All ladies have lumps in their breast.
Yes, that is normal.
Oh, okay.
Now it depends on the size.
myself.
Okay, so there are lumps that are, some centimeter in size, so less than a centimeter. So that is like the size of your nail.
Okay.
So, okay, those are normal breast fat. Okay.
Oh, those are breast fat. So you shouldn't freak out if you
Okay.
feel something.
Don't freak out. Okay.
Okay.
The only time that you freak out is if that lump in your breast that you are able to feel is increasing in size. Number
Oh,
one.
it's getting bigger.
Yeah. Number two, it is hard.
It is hard. So it's supposed to be soft.
Yeah, it's supposed to be soft because it is fat and it is your breast. Okay, so it's
Okay.
supposed to be soft. Now, how hard?
How hard is hard?
How hard is hard? Do this. Feel this.
Okay, so tighten.
Yeah.
Press your
Press
thumb
your
and
thumb and your index finger.
index
Press
finger.
this. Okay.
and you. I can feel
Yeah.
this lump
This
here.
is the lump. This is
this
how
lump.
hard it is.
Oh,
Right?
this is called a hard
Yeah,
lump.
this one is what we call as firm.
Firm.
Okay, this is firm. Now do this
Okay. Oh,
and
lump.
feel it again. This is hard.
Oh, this is hard. Okay.
You do not want it to be this hard.
Okay.
Okay.
Okay. Yeah, this is flesh, right? It's soft when I
If
didn't
you-
do anything.
yeah.
So this is like normal breast, and then this is like
Yeah.
hard lump.
No. Actually, no. This one is normal breast.
Okay,
You
it's
don't
normal
do it. This
breast.
is normal.
Okay.
Okay. If you do this,
Ah.
this should already prompt you for a consult.
Oh, you should go for a consult
That's
already.
already
You feel
firm.
so
Yeah.
firm, alright.
That is firm. Okay.
If it's like this, you're in trouble.
Yeah. Now, if you feel this,
Okay.
it can still point to a benign
Or
diagnosis.
could be benign.
Can
could be
be
just,
benign. Okay. But if you feel this hardness,
It's most likely.
most likely that's malignant.
That's malignant.
Okay. So another factor is the size. If the lump is more than 2 centimeters already, okay, increasing in size more than 2 centimeters, that should also worry you because that points to a malignant diagnosis again.
Wow, this is so instructive.
Next one is skin changes. Breast cancer patients have definitely skin changes.
Oh,
okay?
really?
So-
On the breast or
on the
elsewhere?
breast.
On the breast.
So you can have dimpling, you can have wound.
Wounds.
But if you have wound,
Run to the hospital.
okay, that is at least stage 3
At
breast
stage-
cancer.
wow, at
If
least
you
stage
have
3.
wound, okay, because that is a sign of what we call as an inflammatory breast cancer.
Okay.
Inflammatory breast cancer, once you get diagnosed with that, that's stage 3.
That's stage 3, and that's
Okay.
that's very, very serious.
Then another sign is you can feel your lymph nodes. So you have lymph nodes in your axilla or your armpit.
Underarm.
Yeah, underarm, you can feel the lymph nodes there. You should not be able to feel any lumps there. Okay.
Okay, yeah, I was wondering. I
No
don't
lumps.
feel
Huh?
anything.
No lumps. But
Okay,
if
okay.
you feel a lump at the axilla and you have a breast mass, you would think you have probably stage 2 or stage 3 breast cancer.
Oh, wow.
Okay. You have axillary lymph nodes that are enlarged.
Mm.
If you feel lymph nodes here in your neck,
Mm.
in your shoulders,
Mm.
okay, that's at least stage 3 or stage 4.
Wow, if you feel lymph nodes, the swollen lymph nodes in your neck and shoulders already.
Yeah.
So, if you've been ignoring the lump in your breast and now you feel something in your neck, it's time.
It's advanced breast
It's
cancer.
advanced
Yeah.
already. So,
Now, another one is the body pains.
Mm.
If you feel body pains, back pain, low back pain, knee pain, joint pain, elbow pain, headache, chest pain,
together with lumps.
together with the lumps, the lymph nodes, that's stage 4 breast
Wow.
cancer. Okay, that it means that the tumor has already metastasized to your mucus.
Wow.
Okay.
Wow. Thank you, Doc. I think it's so useful for everyone because these are things that we can do without even going to the hospitals. And these are telltale signs. I just want to repeat, this does not replace actual diagnostics like mammogram, but this is definitely, if you can see these signals, you should go for your mammogram and go and see a doctor. All right?
Okay.
Doc,
So
colon cancer next.
let's go to colon cancer. Everybody loves to eat, right?
Yes, everybody
so
loves to
if
eat.
you are somebody who is a foodie, then I think this is one of the cancers that you wouldn't want to have on you because once you get colon cancer, an advanced stage of colon cancer, then there will be a lot of limitations in what you eat. Okay, and in the consistency of the food, solid food, liquid food, okay?
And if you have colon surgery, does that impact the way, what you can eat for the rest of your life?
Definitely. We have had patients who are on colostomy, and some patients actually had metastasis to the liver, to the esophagus, to the stomach as well. No? So they have a lot of restrictions when it comes to diet or to food.
Wow.
So these patients would if they have difficulty swallowing, if they have malabsorptions, they easily bloat.
So basically they can't enjoy food anymore.
They can't enjoy food anymore, and we all know that food is one of the joys of life. Okay?
Doc, for colon cancer, if you detect it early, what's the success rate?
If you detect it early on, it's almost 100% as well.
Wow, that's great news. That's really great
but
news.
the thing is with colon cancer, it is silent most of the time.
Oh wow, so very hard to detect.
It's very hard to detect without using colonoscopy, without using tests. So if you experience blood in your stool, you have alternating constipation and diarrhea, you are getting thin very fast. Okay, so those are
don't think that is your diet working, huh? Okay, don't think that you suddenly God granted you your wish and you are getting thin. No.
That's one of the telltale signs of colon cancer.
Yeah.
Okay, especially when you poop so much, it's red.
It's red.
But of course, don't be afraid because blood in stool doesn't always necessarily mean colon cancer, okay? Because it can also mean hemorrhoids. But it is also part of an underlying problem.
So if you have hemorrhoids, sooner or later it will most likely good chance of developing prostate or colon
cancer. But not from the hemorrhoids.
Yeah, not from
It's
the
because
hemorrhoids.
of your diet, because you lack fiber in your diet. Okay, that's why you got hemorrhoids. You are straining so hard just to poop out your poop.
Wow.
Okay, and low fiber can increase your chances of getting colon cancer. Okay.
So Doc, most people discover their colon cancer by accident?
Yeah, through screening. So the earliest that you can get colonoscopy for the general population, for all people who doesn't have any family history of colon cancer is 50 years old. Then you do it once every 10 years. Okay, so right then and there, if the doctor sees a polyp, they can just excise it. Okay, so if the polyp turns out to be cancer, you're lucky because they have already removed it. Okay.
Oh wow.
Yeah, so that's both diagnostic and therapeutic.
Wow.
If it's early age,
And is colonoscopy expensive? I mean, I always ask this question because I think it's important. Normally when patients see the doctors, they don't dare to ask, "Doc, are you expensive?" Right? Because it's weird to ask the doctor whether he's expensive when you're already in front of him.
Yeah.
So is colonoscopy expensive?
It can range from 20 to 30,000.
Oh wow!
Yeah, but insurance covers it. So
okay. So those of you who are not insured, and do start up a little piggy bank for when you're 50 years old. Go for the colonoscopy.
Yeah.
All right. Okay.
Yeah. So that's for colon cancer. Okay. So
next is
prostate cancer. Now let's go to prostate cancer. No? Okay. So prostate cancer is one of the slow-growing cancers as well. So that's one of the good news for this, and it's silent most of the time. Now, when you experience symptoms in the context of prostate cancer, okay, so these are what you will be feeling. So voiding or obstructive symptoms. So you will either have hesitancy, poor or intermittent stream. So you don't.
Sorry.
Guys,
you use very nice language. You say voiding or obstructive system. Are you talking about poo-pooing or what?
Urinating.
Oh, urinating. Okay. So when you have these symptoms while you urinate, all right, that's some signs for you to consider.
Okay, so when you're urinating, you experience
what's hesitancy? Maybe it's shoot and stop, or
the feeling that your urine is about to come out but it's not coming out.
Oh, okay.
Yeah, that's hesitancy.
Okay.
So or poor.
Sorry, Doc, I'm asking like this because I'm looking at this and I'm wondering, what does it mean? Okay.
That's the feeling.
The feeling of wanting to pee, but the pee doesn't come out.
Yeah. Okay, so another one is poor or intermittent stream. So guys,
no power.
No power, or it's like it's like a sprinkler.
Oh, it's not like a jet.
Yeah, it's like a stream. It's like it's like either a jet or like intermittent shooting. No.
Okay.
Yeah. Okay. So that's an intermittent stream. Then straining, when you have to strain in order to pee.
Wow.
That is also an
Okay.
obstructive symptom. Or prolonged micturition. Micturition is another term for urinating. Okay.
What do you
So,
mean? You
prolonged. It takes a while before you empty your bladder. Like
doesn't mean your bladder. Doesn't mean you have a big bladder. No.
No. For most men, okay, it only takes a minute before you empty your whole bladder. Less than a minute, actually.
Yeah, actually, a minute is like pretty
It's like-
long.
it's pretty long.
Pretty long.
When you
I think like
urinate,
15
it's like
seconds is-
15, 30 seconds. That's
Yeah,
already
that's
okay.
long.
But if it takes a while, no, before you empty your bladder, I mean, it takes more than a minute. Then that's.
So usually this means that it is accompanied by low pressure, because so it's taking long because
there's something obstructing the outlet.
so your
bladder-
urination is like
Yeah.
more like a drip. I mean a slower drip
slower drip
compared to normal.
to
That's why you
normal,
take
right?
longer
Yes.
to pee.
Yes.
Alright.
Okay.
Okay.
Then feeling of incomplete bladder emptying.
That's a horrible feeling. It's
Yeah.
like after you pee, but you still feel like
Yeah, you still feel
Like
like peeing, but
something
you can't
is-
go out anymore. So
Wow.
that's the feeling of
Okay.
yeah. Okay,
I mean
then-
we're making we're smiling at this, but I know this is not a laughing matter.
okay, yeah, another one is dribbling. Dribbling is after you pee, right? After you pee, you sort of tap.
Yeah.
Yeah,
For guys, we tap.
for guys, okay, you sort of tap. Try not tapping.
Uh-huh.
That is what dribbling is.
Oh, so it's even if you don't tap, you are still like it's like a
It's
leaky
like
faucet.
a leaky faucet.
Like
Yeah.
a leaky faucet.
It's like a leaky
Like
faucet.
when you switch
Yeah.
off, it doesn't off. You can't control it.
Yeah, you
It
can
still,
control it.
Still
Yeah.
drips.
So it's one of the
That's called dribbling.
symptoms. Okay.
Women experience all this too.
Yeah, but it's a different anatomy. So if women experience these, it's a different issue.
Okay.
Yeah, but
Oh,
for men,
okay.
it's
They don't have
it's
prostate,
Okay, so
yeah.
you have frequency, urgency, urge incontinence, or nocturia. Nocturia is frequent urinating at night. Okay, if you wake up 3 times at night, then that's already nocturia. Okay, so all of these symptoms can point to an enlarged prostate. Okay, so if you have this, it can mean that you either have a benign enlargement of the prostate, which is BPH, benign prostatic hyperplasia, or prostate cancer. Okay, so if you feel these symptoms, no, you have to go to your doctor immediately. Okay, to have your prostate checked. Okay, so should consult immediately. But nevertheless, if you feel these symptoms, prostate cancer is highly treatable.
Yes.
So there's still
And it's slow growing.
yeah, the good news there is it's slow growing.
And also the prostate cancer test is very simple.
Yeah,
it's
that's
cheap
the-
because your doctor just puts on a rubber glove
Yeah,
and feels
the
your prostate.
feels, yeah. Now with the prostate, it feels it's similar to using this.
Ah,
Right? Similar
the
to
same
using
test.
this. So, but I think this is for doctors out there who's going to fill up their the prostate, no? But if you are curious enough, you want to feel your prostate, stick your finger up your butthole.
up your bottom.
So, you can do it, okay?
You can feel your own
So,
prostate.
how does the regular prostate feel like? A healthy prostate. It feels this one. It's firm.
Oh, it's firm.
This is the healthy prostate. If you feel this, the hard prostate, that's prostate cancer.
Okay.
Okay, but that's more on for the health professionals.
Wow.
Okay, so that's for prostate cancer.
And we're going to go to our last category
Last one
before
is,
we go to the Q&A, which is lung cancer. This is a scary one because, Doc, when we get lung cancer, usually like for small cell lung cancer, how long does the patient have?
It's really fast. Okay, usually patients don't have more than a year once they get diagnosed. Lung cancer is also somewhat silent, but it's silent early on. But once it invades your airway, you can have chronic cough, incessant coughing.
You're always
Or
coughing.
always coughing. Yeah. Okay. So that's one of the signs. And once you cough up blood, that is one of the danger signs
So
that you have to
don't ignore. If you cough up blood, don't ignore, right?
Yeah, but even if you have chronic cough, no, I'm sure if you have this coughing that doesn't go away, this would immediately prompt consultations already.
You should.
Yeah.
You should. Don't ignore it.
Yeah. So but if you see blood in your cough, and I will just estimate that would be at least stage 2 to stage 4 lung cancer
Wow.
already. Okay?
So that means literally, if you don't do anything, you only have months left.
Yeah.
All right. So don't ignore that. I know in all the olden movies, every time any person coughs up blood, it's like a death sentence.
Yes.
Right. So it still is true today. Okay. So don't ignore something like that. Well, Doc, thank you very much. We now have, for the 4 major cancers, breast, colon, prostate, and lungs, we have good indications. I think the breast one is so good. I really like this test thing. Yeah, because I can help my wife with this, right? Yeah, yes. I can help her. And this is so good. And as Doc said, if you detect it early, it's like 100% treatable for breast cancer and for colon cancer. And even for prostate cancer, if you find it very early, it's such a slow cancer that you can definitely get well and be able to manage it. The lung cancer one is the challenging one.
That's the challenging one.
That's the challenging one.
It really progresses fast.
It really progresses fast and waste no time in checking it out if you have any lung issues, right? It's as simple as an x-ray. And from there, your doctors will know how to progress. All right, I'm sure now you have lots of questions. Who knows? Many of the viewers might be during your talk, Doc, they're already feeling themselves, checking it out, and now they have even more questions because they've done these simple tests. So without further ado, let's go to the Ask Me Anything segment.